Welcome back to the channel. As we begin in a modern clinic corridor, we're setting the stage for an evidence-based, clinically grounded walkthrough on preparing a patient for hemodialysis. Here's a wide view of a contemporary dialysis unit, multiple stations ready, clearly organized, and easy to navigate. This clean, well-lit environment supports infection control, efficient workflow, and patient comfort before treatment begins. This walkthrough is informed by the 2024 work of renal care experts Thomas Coleman, Ayan Dasgupta, and Christopher G. Karsten III, who emphasize safety, precision, and patient-centered practice. The close-up of the dialysis machine underscores their call for careful checks and exact setup. Dialysis preparation is not a checkbox. It's a safety intervention grounded in evidence. The 2024 work by Coleman, Dasgupta, and Karsten shows that standardized, team-based preparation reduces complications, protects vascular access, and measurably improves patient outcomes. Before every session, we verify patient identity, allergies, orders, and access type, then align expectations with the patient. 2024 data links these standardized pre-treatment checks to fewer errors and safer starts. Rigorous hand hygiene is non-negotiable. Alcohol-based rub or soap and water at the right moments. According to 2024 evidence, a consistent technique nearly halves bloodstream infections in dialysis populations. Obtain baseline vitals, blood pressure, heart rate, and temperature using consistent positioning and cuff size. The 2024 guidance emphasizes that accurate vitals guide ultrafiltration goals and medication decisions safely. Inspect the access. Look for redness or swelling, palpate for a continuous thrill, and auscultate for a low-pitched bruit. No BP or venipuncture on this arm. 2024 evidence shows early detection prevents infiltration, infection, and thrombosis. Educate with visuals. Fluid balance goals, symptoms to report, and aftercare steps that the patient can follow. Dasgupta and colleagues in 2024 link patient-centered teaching to better adherence, lower anxiety, and improved outcomes. Let's begin with the assessment phase, which is strongly supported by 2024 clinical evidence. Pre-dialysis assessment. Establish baselines and verify vascular access before initiating therapy. Measure and record pre-treatment weight. Compare to prescribed dry weight and note any rapid gains since last session. Confirm allergies, current medications, last meal, and any new symptoms since the prior treatment. Obtain seated blood pressure on the non-access arm. Repeat and verify if outside target range. Check heart rate and rhythm and record oxygen saturation. Assess peripheral pulse quality. Measure temperature. Report fever of 38 degrees Celsius or 100 degrees Fahrenheit or higher, or note chills immediately. Count respiratory rate and observe pattern. Note dyspnea, cough, wheeze, or increased work of breathing. Document vitals and weight accurately in the EHR with timestamps and any pertinent comments. Next, vascular access examination. Inspect and palpate the AV fistula or graft for warmth, redness, or swelling. Confirm a continuous, palpable thrill. Auscultation follows. Auscultate over the access for a low-pitched, continuous bruit. Absent or high-pitched sounds warrant escalation. Assess skin color, temperature, and integrity along the access. Avoid lotions or adhesive directly on the site. For tunneled catheters, inspect the exit site for drainage, erythema, or tenderness within a clean field. Verify the catheter dressing is clean, dry, intact, and dated. Replace per protocol if compromised. Brief symptom screen before initiation. Coleman's 2024 analysis shows that early symptom identification reduces emergency interventions. Ask specifically about chest pain, shortness of breath, headache, cramping, or nausea since last treatment. Reassess current breathing, dyspnea at rest with speech, or on minimal exertion. Check for peripheral edema and, if needed, JVP, document pitting grade and distribution. Screen for gastrointestinal symptoms, nausea, vomiting, or poor appetite since last session. Ask about headache, dizziness, or confusion. Address safety risks before proceeding. Clarify any chest discomfort, quality radiation and onset, and escalate according to protocol. Patient education is a clinical intervention, not an optional step. Dialysis helps do what the kidneys can't: remove toxins and excess fluid, balance electrolytes, and protect your heart and brain. Our goal is to help you feel better during and after each session and to keep your access healthy long term. Here's what we'll cover today. 1. The purpose of dialysis. 2. How a typical session flows. 3. Diet and fluid guidance. And 4. How to protect your access safely at home. A standard session includes check-in and vitals, machine preparation, and cleaning of your access. Then cannulation with 2 needles for a fistula or graft, or connection to a catheter, followed by treatment lasting about 3 to 4 hours. Throughout, staff monitor blood pressure, symptoms, and machine settings. We finish with rinse back, needle removal or disconnection, hemostasis, and a brief recheck before you go. Diet matters. Limit sodium to control thirst and blood pressure. Follow potassium and phosphorus guidance to protect your heart, muscles, and bones. Use binders as prescribed. Aim for adequate protein and read nutrition labels. Your dietitian will tailor a plan to your labs and preferences. On treatment days, choose a light meal or snack to prevent nausea and space small sips of fluids as directed. Between treatments, stick to your fluid target. Manage thirst with ice chips or sugar-free gum, and note that heavy meals can raise blood pressure. Lighter choices help keep you comfortable. Protect your access. Never allow blood pressure cuffs, blood draws, or tight clothing on the access arm. Keep the area clean and dry. Check daily for the vibration or thrill, and report redness, warmth, pain, prolonged bleeding, or swelling right away. Support the arm while sleeping and avoid heavy lifting on that side. Infection control is foundational and strongly supported by current evidence. Hand hygiene and PPE. Perform before and after any patient or machine contact. 2024 data: proper hand hygiene reduces bloodstream infections by nearly half. Access site cleaning. Scrub the hub and skin prep exactly per protocol. Use chlorhexidine or povidone iodine per policy. Allow full contact time to dry. Machine preparation. Follow facility policy and manufacturer instructions for use. Adhere strictly to manufacturer guidelines and facility policy. No shortcuts. Verify before initiation. Dialyzer type, lot, and expiry. Tubing integrity and secure connections. Dialysate composition, potassium, calcium, bicarbonate as ordered. Temperature and conductivity within safe range. Alarms tested and limits set. Cannulation and initiation must follow standardized, research-supported protocols. Step sequence. Verify orders and consent. Perform hand hygiene, don appropriate PPE, and confirm patient identity and access site. Prep the access using chlorhexidine or povidone iodine per policy. Allow full dry time and place a sterile drape, maintaining strict aseptic technique. Cannulate arterial and venous sites at the recommended angle and depth. Confirm blood flashback and thrill, then secure needles with sterile taping or a securement device. On the machine, initiate at a low blood pump speed. Verify arterial and venous pressures are within safe limits and confirm lines are free of kinks. Titrate blood flow and dialysate flow gradually toward targets. Confirm conductivity and temperature, and address any alarms promptly. Monitor patient comfort. Cycle the BP cuff, assess for cramps, dizziness, or pain, and provide reassurance and comfort measures throughout. Does Gupta's 2024 findings show controlled? Step-wise initiation reduces hypotension, infiltration, and cramps. Document parameters and patient tolerance. During dialysis, monitor the patient, access, and machine at regular intervals. Trends matter more than single numbers. On the display, confirm prescription parameters, blood flow rate, dialysate flow, ultrafiltration target and time, conductivity and temperature. Verify they remain within ordered ranges. Update vitals routinely blood pressure, heart rate, respirations, and pulse oximetry SPO2. A drop in systolic BP by 20 millimeters of mercury MAGAJ, symptom signals impending intradialytic hypotension. Check ultrafiltration rate versus goal. High UF rates, often above 10 ml/kg/heart rate, raise risk of cramps and hypotension. Adjust to achieve the prescribed net removal safely. Interpret pressures. Rising venous pressure suggests downstream kink or clot. More negative arterial pressure with low flows points to needle malposition or access inflow issues. Assess comfort every check, pain, cramps, nausea, chills. Intervene early, warm blanket, slow pump, reduce UF, and document responses and escalation. Karsten's 2024 work shows that early pressure changes, rising venous or increasingly negative arterial, trigger rapid assessment, needle repositioning, or slower pump speed, preventing excess infiltration and clot formation. Post-dialysis care. Confirm orders. Ensure PPE, visualize the access site, and prepare for rinse-back. Perform rinse-back. Return blood with normal saline, then clamp, cap, and disconnect per protocol. Remove arterial and venous needles using sterile technique. Activate safety devices immediately. Apply firm sterile pressure until hemostasis is achieved, then secure a clean, dry dressing. Reassess vitals, blood pressure, heart rate, and oxygen saturation, and compare with baseline. Document net ultrafiltration achieved and post-treatment weight change in the EHR. Complete documentation and provide patient instructions on site care, bleeding signs, and when to seek help. According to 2024 evidence from Coleman, Dasgupta, and Karsten, structured post-dialysis checks reduce readmissions and access complications, lower bloodstream infection risk, improve medication and fluid adherence, and enable earlier issue detection, delivering safer, more consistent patient outcomes. Dialyzer fibers are the heart of clearance, inspect integrity, prime the circuit, and confirm all connections before initiation. Patient comfort is part of therapy. Adjust lighting, offer warmth, position the access arm safely, and keep reassurance ongoing. Sterile setup drives safety. Organize supplies, verify expirations, prep antiseptic, and maintain an uncompromised aseptic field. Monitor what matters: ultrafiltration rate, venous and arterial pressures, conductivity, and temperature. Trend the data, don't just spot check. Team Huddle closes the loop. Share observations, align the next session's plan, and escalate any concerns promptly. From unit to community, evidence-based practice, safe access, and informed patients sustain outcomes. Thank you for advancing dialysis care.